Hey everyone, it's me, and I'm back with a video. Today's video, I wanted to clarify some questions that you guys had on my Plan B video. So I cannot keep up with the comments. There's so many questions coming through, and that's a reason why I made that video. So many women might find themselves in a situation where they need to use a backup method for contraception, and there's so many questions surrounding that. So if you're new to my channel, I wanted to just quickly introduce myself. My name is Adriana, and I am a doctor of pharmacy. I have been a pharmacist since 2011. So I have a lot of experience in the community pharmacy setting, working with patients and answering certain questions about over-the-counter medications, prescription medications, etc. All right, so let's get right into it. So Plan B is a brand name for an ingredient called levonorgestrel. Now, levonorgestrel is a hormone that's typically used in birth controls. Now, it works by preventing ovulation, preventing fertilization, or preventing implantation of the egg into the uterus. Now, it is at a higher dose than a birth control pill, and that's what makes it so effective. So Plan B is one of the top brands that first marketed levonorgestrel. Now, after it was on the market for some time, other generic manufacturers started introducing their product. Now, all the generics have the same ingredient, levonorgestrel. They just will have a different brand name. So whenever you're looking for an emergency contraceptive, you want to look on the back. You want to make sure that it says levonorgestrel 1.5 milligrams. So I was looking on Amazon for generic brands of the Plan B to see if there is another option that some of you ladies can use that's not going to cost you $50. So I came across this product called Option 2. When I came across Option 2, I noticed that it was only $14.99. So let me check Amazon again just to make sure. So yes, so on Amazon, Option 2 is $14.99 and it's available on Amazon Prime. So you can either get it the same day or the next day, which is really important because whenever taking an emergency contraceptive, time is of the essence. So similar to Plan B, Option 2 needs to be taken within 72 hours after the event. Now, even if you're on birth control and you have a slip up, or if you had a condom failure, or if you just had unprotected sex and you want to prevent pregnancy, I recommend getting your hands on Plan B or one of the generics. Since the price was so low, I wanted to do some additional research. So I wanted to make sure that this brand was bioequivalent to Plan B. Now in pharmacy, whenever we're comparing drugs and comparing if they're, let's say, therapeutically effective, we look at something called the Orange Book. Now the Orange Book is like our Bible to let us know if a drug is deemed equivalent to another drug per the FDA. So back in the day, we used to have this thick book and we used to have to kind of search for drug names. Thankfully for technology, there is an online version on accessfda.gov and we're able to just kind of type it in. So I checked Access, let me make sure that's the right one. Oh, excuse me. It's accessdata.fda.gov. So I checked levonorgestrel and I found the application for this brand. Now it's manufactured by Perrigo, P-E-R-R-I-G-O. That's the name of the manufacturer. But the trade name or brand name is Option 2. So now I felt more comfortable recommending this product because I know it's on the Orange Book and it is FDA approved. So this means that it's bioequivalent to the Plan B. All right, so in my last video about Plan B, I went over some common side effects, what to expect, etc. But I did get a lot of questions in the comments, maybe some things that weren't clear. So I want to address some of those questions in this video. And if I don't answer your question, go ahead and rewatch that video because it might be there, and read the comments because there's a lot of ladies having conversations, helping each other out, and discussing their experience with Plan B. All right, so the top most asked question is, will Plan B work if I'm already pregnant? And the answer is no. Plan B will not affect an existing pregnancy. And the second most frequently asked question is about timing of taking it. So whenever you're taking an emergency contraceptive, it's most effective if you take it within 3 days or 72 hours after the incident. Now, I've gotten some strange questions like, can you take Plan B before and then, have unprotected sex? Will it still work? It's not meant as a preventative, so I cannot recommend that. If you are using Plan B this way, you should just be on birth control. But if you're within that 72-hour window, it's shown to work. Now, there are some studies, but it's not on the label that I've read, that's shown that it might work up to 5 days after. So if you're kind of in doubt, I would prefer taking it than not taking it if you're still in that 5-day window. Okay, so who should not use levonorgestrel? So you should not use it if you're already pregnant, if you're allergic to the medication, of course, and you should not take it as a regular birth control method. It's safer just to get birth control pills from a doctor. You'll be monitored. You'll be able to get a birth control pill that's tailored for you, and it's just safer that way. And another question I always get is it effective? So yes, with all the studies, 7 out of 8 women did not become pregnant when taking levonorgestrel. All right, and then another question that I get a lot is, okay, I'm spotting or I got my period, does this mean that it worked? So yes, if you're spotting or getting your period, that means that the pill has worked. If you don't get your cycle within 3 weeks from taking it, that's when you want to worry. You would want to get a pregnancy test and set up an appointment with your OBGYN. All right, now let's review side effects. Side effects often will be nausea, vomiting, dizziness, and breast tenderness. Now, if you become nauseous and you vomit after taking this, well, about 1 hour after taking it, you want to repeat the tablet. Now, this is because there's a possibility that the full tablet did not absorb into your system. To prevent vomiting, there's a couple things you could do. You can have something bland like crackers or toast. You can have some ginger ale or a carbonated beverage to help settle your stomach. So I recommend not being on an empty stomach when taking this. You want to make sure that there's something there coating your stomach to protect you from feeling nauseous. Now, I also wanted to touch base on ectopic pregnancies. An ectopic pregnancy is when the egg is actually inside of the fallopian tube, and this is dangerous. So if you're getting severe abdominal cramping and there's a possibility that you may be pregnant, this is an emergency. So if you're having severe abdominal pain, seek medical attention immediately. All right, and some other important things to note is that Plan B is not an abortion pill, so it will not terminate an existing pregnancy. Plan B does not prevent against STDs or HIV. And Plan B should not be used as a regular birth control method. And if you find yourself using it often, which I've seen this happen, please see a doctor and get evaluated for birth control. For more information, you can go to their website, option2pill.com, or you can go to the Plan B's website, planb.com, or the FDA's website for more information. If you're experiencing side effects outside of what the label says, please be sure to contact a healthcare provider and report those side effects to the FDA. As a pharmacist, one of my main jobs is to scan for drug interactions. So with levonorgestrel, there's a couple things you should know. So there are a few medications that will interact with the pill. An HIV medication called efavirenz and a tuberculosis pill called rifampin, they might decrease the activity of the medication in the body and it won't be effective. So if you're taking either of these medications, speak with your doctor first to see what a good treatment option is for you. In addition, there's also some seizure medications that can interact with the pills. So Also consult your healthcare provider if you're taking anything for epilepsy. All right, so before I end the video, I wanted to just show you the product so you can become familiar with it. This is option 2, levonorgestrel tablet, 1.5 milligrams, manufactured by Perrigo, and the name of the manufacturer is right here. Okay. Now here is their website, option2pill.com. On the back of the box, you'll have all the side effects and warnings listed, so be sure to read everything in detail on here. And there should be a leaflet inside that has additional information, so let's see. All right, so there is a leaflet that comes in the package, so be sure to read that in detail as well. And this is the pill here. So it's not really a big pill if you compare that to my pinky. It's, you know, a pretty average size tablet. And also, prior to taking any medication, you want to look for the expiration date to make sure it's not expired. This one expires on April 2022. And that's it for this video. If you have any questions, comment below. I'll try my best to answer the questions. And don't be afraid to ask a question below. There might be someone that can benefit from your question, or you might benefit from someone else's. Now, if you really want to get in contact with me, you can find me on Instagram at Adriana Charday, and I'll be sure to try to answer your question as best as I can in a timely fashion. And with that being said, thank you so much for spending some time with me today. I hope that this video was beneficial to you, and I'll see you guys next time.